G'day, how's going?
Alright, so Bella, how are you after, when was it? 3 days ago?
3 days ago.
Wednesday, yeah.
I saw a bit of a difference.
Yeah. You did see a bit of a difference?
Yeah, I see a bit of a difference. But
okay.
Yeah.
Like an improvement, yes?
Yeah, just an improvement, but
okay.
It's still kind of the same-ish.
Okay. So mild improvement in the left hip flexor region. And we did we went at it a little differently, didn't we? So instead of going up high in the hip flexor, we went sort of lower down.
Lower down.
Do you feel like that was more on the money?
Yeah.
Yeah. Okay. And have you done anything between then and now, like in the way of dancing or anything?
I've only been doing physio, but that's basically it. I'm going to try and do some dancing next week, just depending on the hip.
Okay, but you haven't done any training or dancing since Wednesday?
No.
Okay, and what day did you see your physio?
Thursday.
Okay, so what did she do with you? Running through the sort of
program
rehab exercises?
Yeah, just jumping on boxes and off boxes and doing hurdles and stuff, so yeah.
Okay, so was there any therapy or was it just running through exercises?
Just running through exercises and just, keeping it.
And you're happy with what you've got to do on that front?
Yeah.
Okay, cool. All right, well we're going to do some more of the same, so we'll clear out of the room, let you get changed, and just open the door for me when you're ready, okay?
Yeah, okay.
Okay, so let's have a look at you here. Just march up and down on the spot for me there, please. Yep. Okay, and when you're ready, you can stop there. Okay, so just bending forward as far as you can, trying to touch your toes. And back up. Okay, just raising that right knee towards your chest, please. And down. Do the left. And down. Do the left again, and down, do the right. Do you notice any difference when you lift each leg? Do they feel relatively the same, or does one feel harder or stiffer? Or?
One feels a bit more stiffer than the other.
Your left one?
Yeah.
Yeah. Okay, have a seat on the bench just facing that way. Sorry, I got the bench up a bit high.
It's fine.
Okay, so just raise your arms up off your chest there. I'm just going to twist you to the right there. And go to the left for me. One more time to the right. A little more stuck here, eh?
Yeah.
Okay, just relax those arms, turning your head to the right and to the left. Just come to the right one more time. Okay, and to the left. Okay, back to neutral. Alright, Belle, let's lie on your back with your head up and stand for me, please.
Okay.
Okay, so just come to this edge of the bench and now slide down towards your feet. Keep coming, a little bit more. That's it. Okay, bend both your knees. So we're going to do Thomas's test here. Not me, Thomas, but some other Thomas who invented this. This is to test the hip flexor length. Why don't we actually start with your good one? So sorry, if I stay where you are but shift all the way over to the right, just for the sake of people to see. Okay, so we're going to bring this leg off the side, and what we're looking for is that the knee rests below the level of the hip, which it does. How does this feel to you? Is there any irritation or discomfort?
No.
It just feels like your leg's hanging off the edge, doesn't it?
It's like a nice stretch.
Yeah. And then we can sort of test the quad length by flexing the knee, and you can feel that tightening a bit, probably anywhere from here right up into your stomach.
Yeah.
But it feels like it's got a bit of give, doesn't it?
Yeah.
Which is pretty good. Okay, so let's compare the left side. So if you come over here, if you want to come around and have a look how this one lies in relation to the horizontal. So the knee is resting below the hip, But how does it feel to you compared to the other side?
It just feels loose.
Feels loose?
Yeah.
Okay, so it doesn't feel tight.
Yeah, it doesn't feel like it has that little.
Do you feel like this is looser than what it has been the first time I saw you?
Yeah.
Okay, and this way? How does that feel?
Alright, actually.
Yeah, so I think the first time I saw you, your knee was sort of resting
Here.
more at this level.
Yeah.
So, I mean, it's a pity we don't have that before and after, but just asking you again, like between the right one, which we did first, and the left, do you notice any difference in sensation? It's okay if you don't, but...
Yeah, this one has more like nice stretch, and I just don't feel anything in here.
So this one feels like it's got a bit more range?
Yeah.
So it goes a bit further? Is that what you feel?
Not really. I'm saying it has a nice burning stretch.
Mm-hmm.
This one, I just don't feel anything. Like.
Okay. Oh, so you don't get the stretch.
Yeah, I don't
It
get
feels
the stretch.
perhaps like it's not stretching as much.
Yeah.
I guess that implies that you don't feel like you have quite the same range.
Mm.
But let's dive in and have a look. So just with Thomas's test, I like to keep both knees up because it positions the pelvis in a more neutral position. If I have her leg straight and light off, you know, the iliopsoas tendon is already somewhat pre-stretched. You might get a false negative in that result. So you can probably keep your knee bent for this again, Belle. And we're going to dive in through here, okay? And we'll do some ART on your hip flexors. So we tend to get pretty up close and personal on this one. So you just tell me if I'm pushing the boundary here, okay? Just let me know if you're uncomfortable or anything. So I like to sort of feel around a bit first, just to see if I can locate a tender spot or the spot that's sort of irritated. And I'll get you to relax your leg as best as you can. Okay. I like to do this so that people can really relax in through here, because there's a lot of musculature in here, and it's very easy to instinctively contract all this muscle. So you feel nice and relaxed in through here. Yeah. Now I've got my thumb sort of poking into you. Is there any sort of exquisite tenderness or pain?
Not at this second.
Okay, so I'm on the tendon of the rectus femoris here. Is that uncomfortable?
No.
That's not where you feel your issue is?
No.
Okay, so we're going to come a bit more medial. Okay, we come into some sort of softer tissue here. What's it like in through here?
Yes.
Yep. Sweet spot?
Sweet spot.
Okay, just need a bit more cream. Is that where you've been feeling your discomfort?
Yeah.
Okay. I always like to keep double checking that this is the spot that we're on, the correct spot on the patient that we're on. Otherwise we're treating stuff that doesn't need to be treated. Okay, so just you keep that leg really floppy. I'm going to control it down, okay?
Yeah.
I was explaining to Belle the other day how because of the location of her injury and what I need to do in order to treat the relevant muscle, it requires me sort of really getting up close and personal, and not just with this hand but also this one as well. I want her to be completely relaxed so that none of that instinctive contraction of the muscle comes into play. As I bring her leg down, I have to sort of keep in contact with her leg and guide it all the way down, which requires me to be in contact with her all the time. And I just like to communicate to the patient that that's what I'll be doing, because otherwise people might feel uncomfortable you touching them like this. But you're all good with it, yeah? Bill? Okay, and how does it feel in through here? Is it a bit uncomfortable?
Bit uncomfortable, well, sore, but it's bearable.
Okay. Okay, I'll just give you a little break there. Just want to poke around a bit more, see what else I can find in through here. I think I will do a bit of work on the rectus femoris as well, because I do feel like there's a bit of tension in through here. So I'll start a bit further back here now.
Yeah.
You okay with that?
Yeah.
You can feel the stretch, yeah?
Yeah.
I really like these ART moves because I can feel the tissue gliding underneath the skin, and just the action of mobilizing the tissue in itself, regardless of how much pressure I'm pushing on here, it's good for it. I mean, when last did any of you watching this have this sort of movement done on you? Often people get up off the bench and they'll feel like the affected side is better off than the non-affected side, purely because it's been sort of warmed up and mobilized. Okay, now I know this isn't your favourite, but I want to just have a feel back up in the top portion, okay?
Okay.
So maybe if you could just come a little bit over to this side, maybe just a little bit further down, just a touch down. Yeah, that's good. Okay. So we're going to go into a hip flexor, and again, I've got to try and get, if I feel her ASIS is here, and I've got to get like in through this. Are you okay with me?
Yeah.
Sort of in here. So with guys, you know, it's easy to have them pull their shorts down or something like that. With a girl, like, so long as they're okay with my hand sort of down this part of her clothing, it's okay. Always get permission. Okay. Alright, so if you feel like you're going to fall over, you can hold here, but if you're comfy, I'll sort of bolster you as well. Now with this one, I am going to need you to lift it off. So just a little lift, bring your foot out to the side, and then just lower it down slowly, okay? And then at the end, let it hang there for a bit. Okay, so I'm just going to reinforce here. Okay, I'll just do a little test first, Belle. Just push your hand up into my knee and then relax. I'm just trying to find the iliopsoas tendon here. Push up again and relax. It's a little difficult to find on you. And push up and relax. Okay, I think I've got it. Okay, so we'll try for about 4 passes, okay?
Yep.
Alright, so when you're ready, bring that leg off to the side. Lowering it down. And just let it hang and enjoy it for a bit. Okay, you just relax there. So I don't know if you caught that on camera, but you can see how she sort of wiggled her foot off, because it's really quite hard to do, isn't it, when I'm pinning it?
Yes.
And I'm not like digging down on it really hard, it's just a very sensitive muscle. Okay, when you're ready, pulling it off to the side. Well done. Okay, letting that lower. And I'm just feeling the iliopsoas tendon sort of lengthen underneath my hands here. Okay, I might see if I can have a go at it now. Okay, so you just keep really floppy, okay?
Okay.
I can do this with Bella because she's very well kept. She's not grossly overweight. Sometimes with people who've got a bit of a belly on them, I definitely need some reinforcement to sort of shift the tissue out of the way, but Belle's got a nice flat tummy, so okay, so just keeping that nice and floppy, I'm going to lower this down for you. I know I said we'd do 4, didn't I?
Yeah.
That was a lie. Okay, pretty good. One more here, Belle. How was that one? You saw that one.
Yeah.
Well done. Okay. So we're going to mix it up now. We're going to do some dry needling on you. Okay. Okay. So just lift your legs up for me. Slide this underneath you. We're going to do some needling around this region, and just putting a pillow under her knees helps to take some tension off the hip flexors. watch me if you want. Bella, are you okay to like fold your shorts in to expose a bit more here? I do want to try and pop some in here. Can you go one more down? Yeah, that's good. Yeah, that's good. Are you comfortable there?
Yeah.
I'm just thinking actually, if I can get sort of like to there.
Okay.
Are you okay to?
Yeah. Okay.
All right. And then we're going to go up in through about there as well. Okay. Alright, all good. Okay. Here we go. I'm just going to pop 1, 2 on the inside of the iliopsoas. How's that? Intense?
Intense.
Okay. Okay, so I'm just feeling for some muscle tension around the left limb here. How was that one then?
Good.
You felt it, yeah?
Yeah.
Okay, so these ones here are more in the vicinity of iliacus. We call it hip flexor. We've got 3 running down rectus femoris, vastus lateralis, vastus medialis obliquus, and then some of the adductors here. And we'll leave these in for probably about 7 minutes. These are what we call structural needles. I've sort of pushed them in all the way, and these are peristructural, so just into the muscle tissue. Yep, and we'll come back in 7 minutes and take them out. Okay, so it's been 7 minutes now, so we're going to take these needles out one by one. Sometimes patients will feel them as a bit uncomfortable as they come out. How's it feel on you, Bella?
Feels fine.
All good?
Yeah.
Okay. Every now and then we get a little bit of claret, so how are we over here? Yep, all good. Okay, so now we're going to do some cold laser therapy, and I've already done some safety checks with Bella. I'm going to get you to hold that. I describe this as a safety mechanism for patients that so long as they're holding it, the laser will work. If they don't, it won't. Okay, so we're going to come into this region here first. Sorry, it's going to be a bit cold.
Okay.
And on we go. So just let me know if you're feeling any sort of heat sensation that's too unbearable, okay?
Okay.
Are you okay so far?
Yeah.
Okay, so this is probably the most anti-climax part of the session because Bella probably won't feel very much at all. And being a hands-on practitioner, I very much like to roll my sleeves up and dig into people and do stuff to them where they can feel something that's happening. But the research that is coming out these days with respect to cold laser therapy and its effect on musculoskeletal injuries is overwhelmingly good, and you've got to keep up with the times, and that's why I've integrated this therapy into my treatment arsenal, if you like. So many people want to know, what is cold laser therapy and how does it work? So first of all, cold laser therapy is probably better described as photobiomodulation therapy. Photo meaning light, modulation meaning to stimulate or inhibit. Therapy, obviously we're doing some treatment, but with laser therapy, which is essentially just shining light onto tissues, we're trying to stimulate tissue repair and or inhibit pain. And I'm using one of the bigger probes here. This has got a wider spread, and the setting that I have it on is one that aids tissue repair. In a moment I'll flick to the smaller probe, which is much more penetrating, and we'll sort of use it to hunt for trigger points that might still be lurking in the hip flexor region, and the laser will serve to break that up, if you like. But the way it works is when you penetrate the tissues with a certain frequency and duration of light, the effect that's carried out occurs in the mitochondria of cells. So mitochondria are referred to as the powerhouse of the cell. It's where metabolism occurs, specifically the production of ATP, adenosine triphosphate, which is the energy molecule which our body uses to carry out all of its functions. And long story short, when there's an increase in the production of ATP, we observe faster rates of healing and decreased inflammation. And that's what the cold laser does. There are specific biochemical pathways that lead to the production of ATP, and it's the cold laser which facilitates this process. I think there are even photomedicine colleges coming out in the States these days. That's how quickly the advancements in laser are happening right now. But laser is in fact an old technology. It's been around since the 50s or 60s even. But the advancements that have been made are to do with the frequency and duration of light. It's also used for hair removal and tattoo removal, but that's a much more intense laser beam, hence why this one's called cold laser, because there is no burning. How are you doing here? Still
good?
All good? No burning or anything like that? Okay, we'll do one more in this region. So I'll flip probes in a moment and I'll explain how that one works, and then I'll turn her over face down and we'll do some laser around her lower back. And this is because her lower back is where the nerves emanate the spinal cord to supply the muscles that are in this region. Incidentally, we don't need safety goggles with this one. The light's okay to look at. With the other probes we do, certainly if you're operating near the eyes, it's good practice to use those safety goggles. Okay, so I'll show you the process of changing the probes here. It's highly technical. Unplug that, plug this one in, that's for later. This one is already plugged in. I'm going to change the settings here. Okay. Okay, here we go. So I don't know if you heard the pitch of the laser go up there. It's difficult to explain this, but imagine the laser at rest is emitting some sort of frequency, and it's getting feedback from the tissues. If you hover it over a tissue area that is more sort of clumped together, more dense, it will whinge more. It'll increase its pitch, and that's how we locate the trigger points. I have to confess, I should be wearing safety goggles, but I'm not. And so long as I keep the laser pointing away from me, I'm safe. But if I was to, while it's on, pick it up and shine it in my eye, yeah, not good. So I'm always extremely careful here. These are 30-second bursts. We're probably only going to do about 2 or 3. You okay here?
Yeah.
Yeah, we might just do this last one. It's feeling pretty clean through there. So after this one, we'll turn you over face down, and we'll do some more on your lower back, and then I'll adjust you. Okay. I've left adjusting till last today. If you've seen me practice in other videos, I tend to start from the outside and work my way in. I like to sort of butter the patient up a bit before I adjust them. Just makes for a more comfortable adjustment. Alright, so we'll go on to the